We talked yesterday about the flu. Other illnesses are making their way through the community too. That includes whooping cough, RSV, and a stomach bug. Alina Dangerfield sat down with a doctor today to find out what folks need to know about these illnesses. Alina, what is the most prevalent illness that doctors are seeing right now?
Renown's division chief of primary care says about 60% of illnesses they're treating right now are upper respiratory. That includes many different illnesses, though several of them are treated similarly.
The biggest things we're seeing right now are mostly the upper respiratory stuff. So ear infections, sinuses, strep throat. Flu has really dropped a lot, which is good. Lots of bronchitis, a little bit of RSV in kids and croup.
Dr. Thomas Humlecek, or Dr. C as he likes to be called, says this season is bringing along plenty of illnesses. Anything upper respiratory is what he's seeing the most of, and they're highly shareable, so schools, families, and coworkers are all at risk of contracting an illness one person may have. Recently, we've seen whooping cough in schools, with at least one confirmed case within the Washoe County School District in the last week. But a quick interaction with a person who has had whooping cough does not mean someone is immediately infected.
The guidelines state if you're exposed to someone with whooping cough in a small room for at least 60 minutes or longer, then you have a risk of getting it. In general, that's a relatively low risk.
He says those symptoms are also pretty unique and help differentiate the illnesses from others.
They're profound coughing 24/7 to the point of throwing up. You make that whoop noise with the cough all the time, so it's very, very pathognomonic. Having said that, everyone's got a cough from around your nose. That doesn't mean you have whooping cough.
Dr. C says if it truly is whooping cough, it will stick around for 2 to 3 weeks with constant coughing. Other symptoms include runny nose, low-grade fever, exhaustion, and anything else you might see with a normal cold. Other illnesses are unlikely to stick around that long.
I think right now we're having a ton of upper respiratory stuff, which mimics it, but obviously isn't as severe. Most of the time we tell people general viruses are 4 to 5 days and you get better. If you're pushing more than that, then we're concerned.
Long-lasting symptoms that mimic normal colds may actually point to strep throat, an ear infection, or maybe pneumonia. Dr. C says more than anything though, anybody who's concerned about being sick should go in for a visit. Dr. C says even though whooping cough is going around, not every person who walks into a clinic will get tested. They only test symptomatic patients and treat symptomatic patients, unless there's been close contact with a family member that has a confirmed case. Covering what's going around, Alina Dangerfield, 2 News Nevada.